The Centers for Disease Control and Prevention (CDC), America's premier public health agency, is facing an unprecedented crisis. On August 27, 2025, the U.S. Department of Health and Human Services (HHS) announced that Susan Monarez, the CDC's director for less than a month, was no longer in her role. This abrupt ousting, coupled with the resignations of 4 senior CDC officials, has sent shockwaves through the public health community. Reports suggest Monarez's removal stemmed from her refusal to comply with directives perceived as unscientific, particularly regarding vaccine policy, under pressure from HHS Secretary Robert F. Kennedy Jr., a known vaccine skeptic. The resigning officials cited political interference and the weaponization of public health as reasons for their departures, raising alarm about the politicization of science at a critical time for U.S. health policy. Alongside her, 4 top CDC officials walked away, slamming the door on their way out with resignation letters decrying political interference and the weaponization of public health. The U.S. public health system, already battered by years of polarization, now faces a crisis that could ripple through vaccine policy, crisis preparedness, and the trust Americans place in their health institutions. So, what the hell just happened, and what does it mean for the future? Picture this. It's July 29, 2025, and Monarez is confirmed by a razor-thin Senate vote of 51 to 47, stepping into a role that's been a lightning rod for controversy. She's not just any appointee, she's the first CDC director to face Senate confirmation, thanks to a 2023 law-tightening oversight. Her predecessor wasn't even confirmed. She was Trump's second pick after David Weldon, a vaccine skeptic, got yanked for lack of support. Monarez, with her background in AI and public health at ARPA-H, seemed like a safe bet to steady the ship. She spoke of evidence-based science, vaccines as a cornerstone, and rebuilding trust. But the waters were already choppy. On August 8, a gunman unleashed over 180 rounds at the CDC's Atlanta headquarters, killing a police officer before taking his own life. His motive? Rage over COVID-19 vaccines, which he blamed for his mental health struggles. The attack wasn't just a tragedy, it was a screaming alarm about the toxic atmosphere surrounding public health. Then came the bombshell. On August 27, the Department of Health and Human Services dropped a cryptic social media post. Monarez was no longer director, with a vague nod to her dedicated service. No explanation, no warning. Her lawyers, Mark Zaid and Abby David Lowell, fired back, claiming she was targeted for refusing to rubber stamp unscientific, reckless directives, and protect her team. The same day, 4 heavyweights, Drive. Deborah Horry, Drive. Demeter Daskalakis, Drive. Daniel Jernigan, and Dr. Jennifer Layden, quit, their resignation letters painting a grim picture. Horry called out attacks on science. Daskalakis, a vaccine outreach powerhouse, decried the weaponizing of public health. Jernigan and Layden echoed the same. Political meddling was suffocating the CDC's mission. This wasn't just a leadership shakeup, it was a gut punch to an agency already reeling. So, who's pulling the strings? All roads lead to HHS Secretary Robert F. Kennedy Jr., a figure whose vaccine skepticism has long stirred controversy. Since taking the helm, Kennedy's been on a tear. He axed $500 million in mRNA vaccine contracts, calling the tech risky. He gutted the CDC's Advisory Committee on Immunization Practices, replacing 17 experts with a mix that includes vaccine skeptics. He pushed to limit COVID-19 vaccine recommendations, pulling them for healthy kids and pregnant women, and just hours before Monarez's ousting, the FDA, under HHS's umbrella, revoked broad emergency use for COVID vaccines, restricting them to the elderly and high-risk groups. Monarez, by all accounts, pushed back. She reportedly refused to rescind vaccine approvals without consulting her team and stood firm against firing senior staff. That defiance, sources say, led Kennedy and his deputy, Stephanie Speer, to demand her resignation. When she wouldn't budge, they showed her the door. This isn't just a personnel drama, it's a symptom of deeper rot. The CDC's been under siege. Since January 2025, HHS has slashed 2,400 positions, with 600 already gone by August. The agency limped along without a permanent director until Monarez stepped in, only to be ousted in weeks. The Atlanta shooting laid bare the physical and rhetorical threats facing public health workers. Misinformation, especially about vaccines, has surged, fueled by years of COVID-era debates and distrust. The shooter's manifesto wasn't an outlier, it was a manifestation of a broader anti-science sentiment that's found a foothold in policy circles. What does this mean for health policy? For starters, the CDC's credibility is taking a beating. It's been the gold standard for evidence-based science, guiding everything from flu shots to pandemic response. But Kennedy's influence threatens to tilt the scales toward politics over data. His ACIP overhaul and vaccine restrictions signal a shift away from decades of consensus on immunization. The resignations of experts like Daskalakis, who led HIV and vaccine programs, and Jernigan, a veteran of emerging disease response, stripped the agency of institutional memory. This isn't just a brain drain, it's a decapitation. The CDC's ability to craft coherent, science-driven policy is at risk, especially as it faces scrutiny over issues like a recent screwworm outbreak tied to Central America. Vaccines, the backbone of public health, are in the crosshairs. Kennedy's moves, curtailing mRNA research, limiting COVID vaccine access, and reshaping advisory bodies, could erode confidence in immunization programs. Childhood vaccination rates, already dipping post-COVID, face further pressure if federal guidance wavers. The FDA's August 27 decision to restrict COVID vaccines sends a chilling message: even established interventions aren't safe from political whims. This could embolden anti-vaccine movements, which have gained traction online and in public discourse. Posts on X reflect the divide. Some cheer Kennedy's reforms, others warn of a return to dark ages of disease. The data's clear. Vaccines have slashed mortality from diseases like measles 99.9% reduction since 1963 and polio near eradication globally. Undermining them risks reversing those gains. Crisis preparedness is another casualty. The CDC's role in tracking and responding to threats, think Ebola, Zika, or the next pandemic, relies on expertise and trust. Losing leaders like Horry, who oversaw injury prevention, and Layden, who managed data systems, weakens the agency's ability to monitor and act. The screwworm case, though small, hints at what's at stake. Without robust surveillance, localized outbreaks can spiral. The CDC's budget cuts and staff losses compound the problem, leaving it understaffed and overstretched. If a major crisis hits, a new virus, a bioterror event, or even a natural disaster, the agency's response could falter, with lives on the line. Public trust, already fragile, is eroding further. The CDC's approval rating, once above 80% in the 1990s, hovered around 40% in 2024 polls. Monarez's ousting and the resignations feed a narrative of chaos and politicization. When senior officials quit citing weaponization, it's a signal to Americans that the system's broken. Misinformation thrives in this vacuum. X posts show users questioning everything from flu shots to basic health guidelines. Rebuilding trust requires transparency and consistency, but the current turmoil makes that a tall order. If the CDC can't speak with one voice, why should the public listen? Long-term, this could reshape public health's foundation. The CDC's global influence, its role in setting standards for disease control, may wane if it's seen as a political pawn. Other agencies, like the World Health Organization, could fill the gap, but domestic coordination would suffer. The loss of expertise also hampers innovation. Monarez's AI background, for instance, hinted at modernizing data systems, now a stalled prospect. And with Kennedy's agenda driving policy, the U.S. risks falling behind in global health leadership, especially on vaccines and preparedness. Yet, there's another side. Some argue Kennedy's push reflects a demand for accountability. Public health isn't infallible. COVID missteps, like mixed messaging on masks or school closures, fueled distrust. Supporters on X claim he's challenging a corrupt system, pointing to vaccine side effects like myocarditis in young men, affecting 1 in 100,000, or pharmaceutical influence. But this view ignores the overwhelming evidence. Vaccines save millions of lives annually, and the CDC's rigorous processes have historically balanced risks and benefits. Dismantling that framework without clear alternatives is a gamble. Where do we go from here? The CDC needs a leader, fast. Acting directors can stabilize, but a permanent replacement must navigate Kennedy's influence while restoring morale. Congress could step in. Some Democrats are already calling for investigations into Monarez's firing, but partisan gridlock makes that unlikely. The public health community is rallying, with groups like the American Public Health Association demanding protections for scientific integrity. Meanwhile, the next crisis won't wait. Whether it's a new variant, an outbreak, or a natural disaster, the CDC's ability to respond hangs in the balance. This isn't just about one agency, it's about whether science can still guide America's health. Monarez's ousting and the resignations are a warning. When politics trumps evidence, the fallout isn't just bureaucratic. It's measured in lives lost, trust shattered, and a nation less ready for what's coming. The question now is whether the CDC can rebuild, or if this is the start of a deeper unraveling.